Hi everyone, today I want to show you the case how to fix crooked nose and crooked nasal tip without touching the tip. This young man asked me just to straighten the nose, and he asked for the man shape of the nose. I did it by close technique, and you can compare before and after, for example nostrils. It was closed rhinoplasty and I didn't touch the tip cartilages. And now I explain you why and how I did this surgery. Look again to his nose. You can see the crooked dorsum. You can see that the tip of the nose is quite good, and usually men they have the tip like this. So they ask to straighten the nose but do not make the changes for the tip. And usually when surgeons they touch the tip cartilages, they change the tip cartilages, and not always nose looks like a man nose. Sometimes it's too feminine. My goal for this surgery was to straighten the tip and to keep all the natural lines of the nose. And of course it was functional surgery. First of all, we need to analyze CT scan. When I saw the CT scan, I saw the huge big deviation of the septum, and especially you can see the big deviation on the tip part. Also there was a spur on the septum, and also you see how the septum was deviated just under the tip cartilages. On the 3D CT scan image we can see the deviation of the septum, the deviation of the upper lateral cartilages, and also we can see the lower lateral cartilages of the tip. But what really helped to analyze the shape of the nose is 3D view of all these structures. And look carefully. You see the shape of the septum. You see how the septum was deviated. You can see the spur of the cartilage. And now you understand why and how the tip cartilages were deviated. So the septum pushed the tip, and that's why it was deviated. That's why nostrils were asymmetrical. From this view you can see that it's not necessary to change all the tip. Maybe, for example, it is necessary just to change the medial crura of the lower lateral cartilage, but we don't need to change all the tip. From this view you can see better the deviation of the septum. The septum was deviated on the cartilages part, and the septum was deviated on the bony part. You can see the difference on upper lateral cartilages. You can see the asymmetry of the bony part of the nose. That's why I like to do the 3D scans. I like to do the 3D modeling of the nose, because you can see everything and you can understand everything about the nose before the surgery, and you can choose the right correct technique for your surgery. For this surgery, first of all, I decided to do closed rhinoplasty, and I decided to do the low strip SPQR technique. So with the low strip I move all the structures to the central part, and by the ultrasound examination I saw that the cartilages are symmetrical. They are on the symmetrical position. You can see it from this view. You can measure the thickness of the cartilages, you can measure the thickness of the skin, and you can see the position of the cartilages. I did closed rhinoplasty with asymmetrical let down osteotomies. Then I moved the septum to the central part. I correct the length of the upper lateral cartilages, and I only changed the lateral medial crura. I make the small overlap from inside. So I didn't touch the tip cartilages. I preserve the shape of the tip totally. You can compare before and after video view. It is 1 month after the surgery. And this is 3D view before the surgery and 3D view after the surgery. You see that the septum is straight now, and you see how I fixed the septum with the strut. Here you can compare two images before and after the surgery. And final result face view 1 month after the surgery. Now we can compare 3D model on the face view before the surgery. Look attentive on the tip, on the septum. Again, you understand why the medial crura is deviated and why you have the asymmetry of the nostrils, because of the deviation of the septum. And now the 3D view 1 month after the surgery. You can see that I put strut under the upper lateral cartilages. You remember that it was the deviation just under the upper lateral cartilages. Then I put the strut between two parts of the septum, because I disconnect the septum and I move the septum to the central part. And you can see the osteotomy lines after the surgery. Before the surgery and after the surgery. How I work with the septum. I cut the septum on the lower part, I disconnect the septum from the bony part, then I cut the deviated part of the septum, I make the cut on the central part of the septum, I move the septum to the central part, I fix it to the central part of the nose, and then I fix both parts of the septum by the strut. Where I get the strut? I get it from the posterior part of the septum. And another strut I put under the cartilages also. I connected the anterior and posterior part of the septum. Now you can compare before and after CT scans. This is the image before the surgery. This is the visualization of the septum after the surgery. You can see that it is completely straight. Before the surgery, after the surgery. Again, remember this deviation of the septum just under the tip, and now it's straight. The side view of the nose before the surgery and after the surgery. The conclusion is, if you want to straighten your nose, if you want to correct your nasal breathing, but you don't want to touch your tip, you want to preserve your natural lines, it is possible to make this surgery by closed technique, and it is possible to preserve the main cartilages of the tip and make your nose natural and beautiful. Thank you very much.